speaking today with the Doctor of Speech Pathology at Epworth Hospital, Margaret Mealings. Hello Margaret, how are you?
Hi Eva, nice, thank you.
Oh wow, well we go back a long way. You were my personal speech pathologist at Epworth Hospital 25 years ago. Oh gosh, it's getting a long time ago. So, obviously, and so your dedication to the profession of speech pathology has stretched over decades. Can you explain what the modality is, please?
Yeah, so I guess speech pathology, when you first kind of hear the name, it sort of talks about speech, and I guess my big mantra is it's more about communication. So speech pathology as a profession, it's about talking, listening, concentrating, being part of social relationships, how you are with your friends, your family, with your workmates. So it's a really lovely, broad area to be able to work in, and I guess that's what's kept me involved for a really long period of time. And I was just really lucky enough to get started way back as a green young clinician into the area of brain injury rehab. And I just really liked the fact that it was a new area. There was lots of new learning about directions and what's the best way for people to support these clients who have had brain injuries. What can rehabilitation do? So it was a really exciting and interesting area to work in with lots of flexibility for us as professionals to learn and I guess forge a pathway in rehabilitation. So I've kind of stuck with it over all of that period of time. So obviously the way rehab is now is so completely different to how rehab was when I started, 40 years ago or something. And it's been just such an interesting journey for me, and I hope along the way that I've been able to support the people that I work with and their families and the wider circles that they all move in to understand a little bit more about what's been happening for them and work collaboratively to try and forge some better pathways for people along the way.
Yeah, great. So actually hearing you tell me what speech pathology is, because to tell you the truth, in my memory of our sessions together, it really was you teaching me how to get my mouth around the words again, post brain injury.
Yep.
You have to learn to talk again, almost in a way. But it's interesting to hear you say that speech pathology actually spreads out over interactions and communication and relationships, because in my mind, I didn't remember that. I didn't remember it that way. And I was going to ask you how speech pathology and acquired brain injury intersect, and now I can see how they do intersect. Yeah. However, I wondered, can you see there being a need for more focus on relationships in the rehabilitation setting?
Definitely, and I think it's that's an area that there's been a lot of development in probably the last 10 years or so. From the whole beginnings about, making sure that people understand what's happened to them, that their families understand, so that there's a bit more positive communication between people. But starting to kind of look at, well, what does the person do socially? How do they go out? How do they manage when they're out and about in the community? Because there are a lot of things around communication, like coping with noise, coping with lights and actions, and sensitivities to all of those sorts of things. Managing fatigue. So can you actually go out and socialise? How do you do that if going out for a whole night's going to be really exhausting and you end up a mess the next day? How do you balance all of those things? So I think speech pathology has to be really part of a broad team approach where we all have a bit of a specialist area that we can contribute, but all work really closely together because, say, a neuropsych might, or a neuropsychologist to be use the right term, will look at thinking and be an expert in that area. But my role is to sort of go, okay, if this person is struggling with memory, or they're struggling with fatigue, or they're struggling with being able to reason through things clearly, how can I then look at some ideas, some strategies, some techniques that kind of suit that particular person to then help them make the best of those thinking skills that they have, so that in a situation they're actually doing quite well, you know, to the best of their ability, and we can improve that and help build on people's confidence and get out and do more.
Well, of course, because every brain injury is different. So you're dealing with a completely individual set of circumstances with each person.
Yep.
And so you work somewhat at the coalface of rehabilitation. You're working in a hospital, you're working with acute patients that are going through acute situations. It must be difficult, because you have to understand that once that person leaves hospital, they've got the whole rest of their life in front of them, the whole rest of their life in front of them with a brain injury. How do you cope with the fact that you are having impact on that person just for that amount of time, and how do you feel that you can tool the person up for the rest of their life?
Well, I think number one is realising that I am only there for a short period of time, or you know, the entire rehab team's only there for a short period of time. I guess the biggest progression in rehab has really been a shift away from just working in the hospital to being a community-based provider. So most of the work that I do now is part of a community-based integration team. So we go out and see people in their own home or in their own community, and kind of work with them there. So I might go to someone's house, and if they're having trouble with, say, memory difficulties, I might look at, you know, tell me what you used to do. How did you remember things before? Were you a diary user? Did you use a phone calendar? Okay, from there, what are the things that we could improve on or do more of? Or if you never used any memory strategies, what do you think would suit you as a person now? So very much trying to make my suggestions and thinking something that I'm doing along with the person I'm working with, to find something that suits them, because what works for you might not work for someone else. The same as, you know, if a doctor told me to do X, Y and Z, I might be really upset or find that really difficult to follow. But if they said the same instructions to someone else, they'd be really happy following it. So I think judging what works the best with the person that I'm working with, because then also they're taking on board those strategies, they own them. And I think that's the other nice part about working in the community, that I'm kind of a guest in someone's home. I'm not in the hospital and I'm the expert and I think this is what you should do, Eva, you know, you should follow this and you should do this. If I'm going to your home, you're the homeowner, you know how your family works, you know how your home works, and I need to go there and be the person that is respectful of that, that works within that, and hopefully then that gives you a bit more of the control and that sense of, oh, yeah, I like that idea, Margaret. Yeah, that sounds great. I'm going to go and try that. So when I come back later, next week or in a couple of weeks, I'm checking on something that you've taken ownership of, not, oh, have you done what I said that you should do, because that will make you better. So hopefully that change that's happened in rehab will make a difference for the person, because they'll take it on board as part of their ongoing way of doing things, that hopefully will allow them to do that more confidently, feel better about it, and it's not just based on what I've told them as an expert, if that makes sense.
So it must be interesting for you to have such a long career, because especially, well, I'm thinking about me and myself and my interaction with you back at the hospital. And you only saw me in the office. You only saw me in that window. Oh God, I can't even remember what direction
Room.
it is. The room. I can
Yeah.
still remember the window. I can still remember how dark it was in there, and we didn't have the interaction at home. I think it would be really, really, really interesting for you now in this day and age to be able to help people with reminders on their phone, because that didn't exist for me.
Yes.
I had to leave hospital and start writing in a diary, and this was with handwriting that was not good at all. I could hardly write at all.
Yeah.
And to this day, I write in letters that are this small because I had a small diary and I had to fit in all the appointments that I had in this tiny writing.
Yeah.
But I just think that would be such a point of fascination to have weathered the change from analog into digital in so many different ways.
Yeah.
Has
Absolutely.
That,
Yeah.
So is digital something that you work with a lot now with
if
patients?
that's what the person wants.
Yeah.
Yeah. And not everyone does it well,
No.
and there's a lot of people that are much better at it than me. So I'm kind of going, oh, show me how you would normally have done that. Oh, okay. Can you remember all the steps? Let's work it out and make sure that sort of works well for you now. So again, it's really it's not a prescription. It's really trying to remember that, this person is the person in charge of their life. These are the things that they want to try and work on. How can I best come up with some tips and some strategies, some recommendations that might make that a bit better for the person? Knowing that, I'm not going to be there for the long term. I must say, we're really lucky in our community approach to be able to be involved with people for a year or two after they've left hospital.
Yeah.
So it's a really important transition time of beginning to do some of the rebuilding and thinking about, what the person wants to focus on now. Are they keen to get back to work or study? And
are they capable?
And if that's going to be a really big challenge, what else do we look at in terms of keeping busy and finding interesting and enjoyable ways to spend time?
Yeah, so I was looking at the papers that you've published online, and I see that you have quite a fascination for students that have acquired a brain injury and their return to study.
Yep.
Could you talk about that a little bit?
So I guess that interest developed from my work. So for the people that I was seeing, so many of them being younger people, because we know that to have a traumatic brain injury, a really large group of people are those people who have unfortunately been involved in things like car accidents and stuff. So it tends to be younger people, sort of 16, 17 up to the early 20s or so. And it just happens that a lot of those people are in that phase of their life where they're trying to get back to study, and that's really what they wanted to focus on post their injury. So for me as a speech pathologist, my interest is communication, listening, talking, reading, being able to pay attention. So those sorts of skills are really core underlying skills for study. So it made sense as a speech pathologist to be someone who could upskill in that area and provide a direction and way of working. And I guess making that something that just wasn't me doing it, but also trying to say to the world of rehab, hey, this is an area that's really important for our students. What's the best way of approaching that? And so my interest was drawn from the people that I was working with and getting to understand their experience. I think in rehabilitation, we can tend to sort of get onto we're the experts, we know. And my passion has really been throughout to try and I guess work at that personal level. Who's the person that I'm working with? What's important for them? How do I get them to harness their own strengths and get over the things that they're finding challenging and working with that particular person. So that's what started my journey into finding out more about study. I interviewed a whole lot of students, got them to reflect on their experiences, and kind of from there tried to identify ways that the rehab community might be able to support those students into the future.
I wanted to ask you, how does being employed at one hospital for so long help you with the progression of your career, and how does it allow you to deep dive into areas that perhaps people who are employed at a place for only a short time might not have the opportunity to?
I think I have benefited from staying at the same place, but I also think I was really lucky to start at a rehabilitation centre that was really interested in developing and researching and trying to forge good pathways. You know, I think, as I said right at the start, I came into rehab when it was still pretty early, and we were all learning a lot. And I think the one thing from remaining at what was Bethesda and now Epworth is that there have been a lot of people who have wanted to find out more, who've wanted to learn, who have wanted to look at how we can do rehab better, always thinking about our outcomes, sort of not so much just the process, but what's happening and what's changing for the people that have gone through our programs. And we've been lucky enough to have research that's followed people up for 10, 20, 30 years after their injury and see how things change. And that's really informed then what are the key parts of rehab. So because I was in then, I guess, a supportive environment that encouraged people their staff members to go off and learn and do more, I kind of, nibbled at the edges, got a little bit interested in some extra study, and was supported through some scholarships and things that were available to me, and using some flexible part-time work and doing all those sorts of things. Ended up, doing my PhD, which was great. And I think I was able to do that because I stayed at the place for a while, but also because I was really interested in moving forward as well. I didn't want to just do the same work the same way for 10, 20, 30 years. I was kind of going, what else can we do? How else can we look into this? What else can we learn and move forward with our rehab? And that's the interest that I've had, which has hopefully had a positive impact for the clients that I've worked with over the years.
I think it sounds it that way. It almost sounds more than just the clients that you're working with personally. But how have you seen speech pathology as a modality evolve over this time? Because you said it was fairly early. It wasn't the whole brain injury thing was a great unknown. So how have you seen speech pathology evolve over your career?
I think the community rehab has actually grown, and there's some really good education opportunities and some really good peer networks and peer supports that have encouraged each other to really highlight the positives of working in that community setting as opposed to the structured outpatient setting. So I think there's been a real openness and learning, and therapists really collaborating with each other to develop and continue improving and changing. Because I think there's a recognition that, any knowledge I have, it's pretty useless if it's just my knowledge. But if I can share it with others and then learn more from them because they have some feedback for me about, what my thoughts are, we keep on improving and changing. So I think that's been the benefit. And there are some fantastic peer support networks and things like our ASBE conference, which I'll give a little bit of a plug for, which is the Australasian Society for the Study of Brain Impairment, which really helped to advocate and spread the message about how do we work best in a positive framework for the people we're working with.
Well, hearing you talk about that just a second ago, about how it's a collaborative effort, and it's a two-way learning opportunity. I have to say, I mean, I know you came and you took part in a by accident back in 2018, and you can see that was manifested, because I give over my experience, and everybody in that whole room is seen as an authority of their own experience, and we all walk from that room with new knowledge and with new skills. And so, how have you seen the rise of the peer in your career, and what are your thoughts about that?
It's absolutely important to try and, I guess, open the pathways into some of the peer supports and peer networks that are available. In a small way, we try to, I guess, get the seeds of that going through some of the rehab work that we do. So we, in our community team, we run a group, used to be called the transition group, now it's called the community group. But it's all about just people coming together after they've left hospital, and they're in that early stages of getting used to being at home, having a bit of an opportunity to come together socially, to chat, to share their experiences, to learn from each other, to hear, oh, you're starting your return to driving process. How is that working? Oh, you're thinking about getting back to work, or, oh gosh, you know, work doesn't seem to be going so well for you. What have you learnt? How, you know, just hearing those sorts of experiences, I guess it helps to realise you're not the only person going through that. And even though you've got your own individual experience, there are a lot of shared experiences as well. So I think that sense of group interactions is really, really important. So that's part of the rehab process that we've sort of been focusing on over the last 20 years or so. And I think the other part that we're getting more active in is trying to support our clients into making the jump into some of the community supports like BIM and so on. So perhaps supporting a client to go along to a session rather than thinking that they'll just go on their own. Because that's a really big ask to walk into something where you don't know anyone.
Especially when you're in your toddler stage of post-brain injury. Because I always refer to it as it's a second childhood coming out of severe injury. All right. Thank you so much, Margaret. It's been wonderful to talk to you and to share on this stage.
And what a wonderful journey you've been on.
Yes.
Well done.
Thank you. Thank you very much.